We're in lab 9 of the appendicular skeleton, so going through the bones as well as select ligaments. And we'll start here with the scapula, and we'll just go right down the list. And we have a number of images. Some of the images have labels, and then you have an unlabeled image, and it will follow that pattern. So let's begin, get our pointer ready. All right, so the list begins with the 3 borders for the scapula. And we have the superior border, just the top edge of the bone. The straighter side, it is closer to the spine, known as the medial or vertebral border. And opposite of that, the lateral border, running more at an angle. So it could be called lateral or axillary border near the axilla. The next term, the spine, is on the posterior side. So we have to turn it around. We see a view here from the lateral side. Let's go to the posterior view. And this narrow ridge of bone here is the spine for the scapula. And following it out laterally, the enlarged area is now the acromion. This is at the area of the shoulder, the acromion process. So now referencing the spine, we have this depression that is superior to it, so known as the supraspinous fossa, and inferior to that spine, there's now the location of the infraspinous fossa. The coracoid process, best seen from the anterior side, and we'll turn it around and see it here. So this curved portion here is coracoid process. On the anterior side, we also get a view of the subscapular fossa. So that's all of this depression here, the subscapular fossa. The glenoid cavity or fossa is on the lateral side. It's the socket for the humerus. And we'll turn to the lateral view to see that here. And we have that for details of the scapula. So we have the clavicle here, and we're just looking at the 2 sides, acromial end, closer to the shoulder, and connected to the sternum. There's the sternal end. And we can recognize the acromial end. You notice we see this little bump here, closer towards the acromial end as a hint. We're not concerned with that particular term there, but just a helpful landmark. Here we have the humerus, and we're able to start with the rounded head. Just after the head's the narrowed area of the anatomical neck. This is a long bone in the slender midsection, the diaphysis or shaft. We have, again, greater being larger, lesser meaning smaller, the tubercles. So the larger lateral greater tubercle, the smaller, more kind of anterior, more medial, lesser tubercle. And the groove running between them is called the intertubercular groove, or sulcus. And we could zoom in on those details. So a closer look. Again, the rounded head. Just beyond that, the groove, the narrowed area of the anatomical neck. We have the paired, now lesser and greater tubercles, with an intertubercular groove running between them. Continuing with the list now, along the lateral side of the shaft, and that's where we are here, towards the lateral side, we see that bump here, known as the deltoid tuberosity. And the remaining terms now on the list are all towards the distal end. And we can start in this area. There's 1, 2, 3 bulging areas there. Of those three, the medial two make up the trochlea, and the lateral third bulge is the capitulum. Surrounding each of those traits, there's now a lateral epicondyle versus the bigger protrusion of the medial epicondyle. The next term, we need to spin to the posterior side. And there's an olecranon fossa is the deeper fossa, the deeper depression on the posterior side. And then we go back to the anterior view. And the shallow depression is the coronoid fossa. And here's now a closer look at the distal end. So we'll start here with the trochlea again. And the lateral bulge remaining there is the capitulum. On either side of each of those, there's a lateral epicondyle versus the medial epicondyle. Here we can see that shallow depression of the coronoid fossa on the anterior side. And on the posterior side, the deeper depression, olecranon fossa. So now we'll move on to the ulna. And with the ulna, we'll begin here with the trochlear notch. It's all of this big groove here. It's the trochlear notch. And on either side of the trochlear notch, at the extreme superior or proximal end, this forms the olecranon process, truly the point of your elbow. And on the opposite side, inferior or distal, protruding out, there's a coronoid process. Moving down to the inferior end, the rounded edge of the bone, known as the head. And we just have to rotate it. We can see that there's a head and the spike hanging off at the very inferior portion is a styloid process, that point. And now moving over to the closer look of the trochlear notch, flanked by the olecranon process, and the label, I think that's a little off, should be more like here. Opposite side, coronoid process. So now moving on to the radius. Once again, there's a rounded head. This is the proximal end of the bone. And moving inferior to that, there's the bump here of a radial tuberosity. And then we have to pass all the way down to the distal end, the inferior side, and there's another point again, a styloid process. So now we're moving into the hand, and at this point the entire hand from the wrist, carpals, all the way to the tips of the fingers will be one articulated piece, one hand all together. So we'll start with the carpals. There's 8 short bones, carpals here at the wrist. And you notice here for reference, here's the thumb, the pollex. And we're looking at the anterior view of a hand, the anterior view of a right hand. And we'll start here now with this first carpal bone. So you notice we're to the lateral side, again, near the thumb. Opposite of that be medial. And we're starting with the superior or proximal row of carpals first, and then we'll move into the distal inferior row of carpals. So starting from the lateral portion, the superior row of carpals starts with the scaphoid. Moving medially over, the next one we see is lunate. Medial to that, the next one we have here, the term taquitrum, There's one name for it. There are alternate names, of course, you could use. And now anterior to the taquitrum, so it's sitting just directly anterior to it, there's now this bone pisiform. So now we'll move back to the lateral side, but now go on to the distal row, the inferior row. And that puts us at the trapezium. And the next one over, trapezoid, capitate. And then the final one here, and this is all one bone here I'm highlighting, has a little spike coming off of it, but it's all one bone known as the hamate. So to do that again, from the lateral superior portion, it's scaphoid, lunate, taquitrum, pisiform, and then going back to the lateral side, trapezium, trapezoid, capitate, and hamate for the carpals. Next in the area of the palm, these are known as metacarpals. And now we just have to add in the numbering system. So again, use the thumb as a guide, the pollex, that's the lateral side. The lateral side's always going to be number 1. And the correct way to name it is metacarpal with a Roman numeral. So I'll write this correctly. Roman numeral 1, or just simply one line. So Roman numeral 1, and then we just count over. Next is metacarpal 2, metacarpal 3, metacarpal 4, and that's written as IV, Roman numeral, and metacarpal 5, 5 being a V. So we want to use the Roman numerals. It's the correct way to number them. So you notice from lateral to medial, number 1 is lateral. So it's just simply the name metacarpal followed by the appropriate number. And that numbering system now applies to the fingers. So the bones of the fingers, the plural form of the word, when you're talking about multiple bones in your fingers, the word is phalanges for plural. But we'll be naming individual bones. So we want to use the term phalanx. I'll just spell it out here for you. And the lab manual has an example as well. So this is the term that we want to use when we're naming a single bone. So for now, I'll just go ahead and cover up the terms that we don't want to use. Instead, we want to use that singular form, phalanx. So when it comes to naming the bones and the fingers, there's a couple of different items that go into the description. The first part of the name now is the segment of the finger. So we can start here with the thumb. The thumb only has 2 bones, 2 segments. So these are known as proximal, and distal. Whereas now the digits number 2, 3, 4, and 5, there's 3 segments. So for these digits 2 through 5, there's a proximal, middle is the term, middle, and then distal. So one of those terms, proximal, middle, distal, will be the first part of the name. The thumb, of course, does not have a middle section. The second part of the name is the word phalanx. That's the name of a single bone in the finger or toe. And then the third part of the name is the appropriate number, the appropriate Roman numeral. So again, I'll correct these here. So as an example in the lab manual, if we were to name this particular bone right here that I'm circling, that specific bone, the inferior tip of your pinky, putting it together. The first part of the name will be proximal middle distal. The second part of the name is phalanx. The third part of the name is the appropriate Roman numeral. And let's just go to that in the lab manual. And we see here the distal tip of the pinky is called distal phalanx 5. Distal because it's the third segment, the most distal part. Phalanx is always going to be in the name for any bone in the finger. And since it's on the pinky, that's digit number 5, Roman numeral V. So that's how it goes together. We'll continue with lab 9. So now moving on to the pelvic girdle, the coxal bone. And we'll begin with just the major landmarks. And we'll go right to our image here. So we have this view available from our large poster, and then we'll go to the pictures of the bones. So to begin the first term there, acetabulum is the socket for the femur, and we'll get a better look at that. Symphysis pubis is the fibrocartilage pad bonding the two pelvic girdle portions together, the two halves. And obturator foramen, we're looking for a hole, foramen. That's that large hole going through the pelvic girdle. And then we have a view of a specimen here. So again, acetabulum is the deep socket. Symphysis pubis, the location of that cartilage pad. And the obturator foramen, so we're looking for the hole there, going through the coxal bone or pelvic girdle. This photograph is, of course, showing a full pelvis, but the pelvic girdle, again, is just this large element here. Or here it is, isolated. So just a single coxal bone, also known as os coxa, also known as pelvic girdle. And to begin, this single bone develops from 3 embryonic bones. So if you had to divide it, it would look like so. And right about like so. So this superior portion, everything above this line here, this is all the portion known as ilium. The posterior inferior portion, so I'll highlight it here completely in red. This area here now is known as ischium. And now this anterior inferior portion, so seen right here, this is all the area of the pubis. So this happens to be a right side coxal bone, and here's the anterior side versus the posterior side back here. Ilium, ischium, and pubis. So now we'll go into the details specific to the ilium. So again, superior to this region is all the ilium. And we'll begin with the term iliac fossa is actually on the medial side. So we'll have to spin it around to a medial view. And we're looking at this region right in here for iliac fossa. The superior edge of the bone is iliac crest. And now at the edge of the crest, if we go to the anterior side or the posterior side, at the edge of the crest, it makes the point, and there's an anterior superior iliac spine and a posterior superior iliac spine on each side of the crest. And then we just drop down below each of those, and there's an anterior inferior iliac spine, as well as a posterior inferior iliac spine. And this again is a right coxal bone. We're viewing the medial side. And we'll go back to the lateral view. And again, from that iliac crest, posterior superior iliac spine, anterior superior iliac spine, and then dropping down inferior, anterior inferior iliac spine, posterior inferior iliac spine. The next term, auricular surface, is on the medial side, so we got to rotate it again. And we're looking at this region here on the medial side, the auricular surface. And the final term, greater sciatic notch, is this big crevice right here. It's that greater sciatic notch. So now we're going to move on to the ischium detail. And we have an individual image for that here, the ischium detail. So starting with this very thick area here, that's the ischial tuberosity. As it narrows off, that's going to lead us to the area of, let's see, what term do we need? Next term, ischial spine, actually above, superior, up here. Inferior to that greater sciatic notch, the point of the ischial spine. And the third term we need is now paired with the greater sciatic notch, the smaller groove. That is the lesser sciatic notch between the spine and the tuberosity. So this term we don't need at all. And still a better look at that foramen, obturator foramen, as well as the socket, acetabulum, just general traits of the pelvic girdle. So now lastly, we'll move on to the details of the pubis. And using the obturator foramen as a reference, the ridge of bone you see kind of anterior and superior to it, that is the superior ramus for the pubis. And then inferior is where we have the inferior ramus, comes out to about here. Inferior ramus for the pubis. And then we see just a little bump here, this protrusion, is that term, the pubic tubercle. So now moving to the next page in the lab, and we're going on to the femur detail. And that's what we see here is a femur. So we'll begin with the head. So this rounded proximal end of the bone is the head, the narrowed neck of the femur. And again, greater and lesser, the bigger, larger, lateral, greater trochanter, the smaller, medial, lesser trochanter. The next term, we have to go to the posterior side. And that's where we're able to get a good view of that intertrochanteric crest, between the two trochanters. So again, we can see the larger, greater trochanter, lesser trochanter, and the crest connecting them two together. Also on the posterior side, linea aspera is just this narrow, the word means line, this narrow ridge going right down the posterior side of the diaphysis. The remaining terms on the list are all at the distal end. So we'll start with the condyles. You notice there's a medial condyle and a lateral condyle. And as a reference, the medial condyle is on the same side as the head. They both face medially. Between those, it's a little cut off here on the image, but what's called intercondylar fossa, because it's between the two condyles, that depression. The next term, patellar surface, the patella is on the anterior side, and that's where we would see the patellar surface on the anterior side of the femur. And now, we've already pointed out the condyles, but on the extreme edges, out here, protruding out, medially and laterally, there's a medial epicondyle and a lateral epicondyle. And we can see those from the posterior side. So again, closer to the center of the bone, that's where you have the condyles. And then on the extreme edges is where you have the epicondyles. And the next bone we have here is just a closer look at the femur. So the head, the narrowed neck, the two trochanters, and we'll spin it around. Better look for the dorsal side. Greater trochanter, bigger, lesser trochanter, and connecting them together, intertrochanteric crest. It's not labeled, but we see the linea aspera. Still yet another view of that proximal end. And go into the inferior end, so we can see now epicondyle, a medial epicondyle, patellar surface right in the center. And on the opposite end, a lateral epicondyle. The condyles are best seen from the inferior or posterior side. So here's a better look at the lateral condyle versus the lateral epicondyle. And the same goes for the medial side. The medial condyle at the much more extreme edge, medial epicondyle, with the intercondylar fossa right in the center, and of course it's on the posterior side. And that'll move us along to the patella. There's no details we need, just recognizing a isolated patella. So now moving on to the crus, this is where we have the fibula, and there's just these three details. There's the head, the narrow, slender shaft, and the opposite end, lateral malleolus. So as we take a look at this specimen here, you can see the head in this case kind of has more of a defined, a little tip to it there versus the lateral malleolus. And then moving on to the tibia. The tibia, this will begin with the condyles. So there's both a medial condyle and a lateral condyle. And a hint here, you have the last term on the list for the tibia. The very extreme distal end that hangs down is called medial malleolus. And that's, of course, going to be paired on the same side with the medial condyle. The next term, intercondylar eminence, we have to spin it around to the posterior side. And this picture gives us a better look at those first three terms. So again, medial malleolus. So this has to be the medial condyle. Opposite of that, lateral condyle. And between the two condyles, it's raised up. Intercondylar eminence is the term there. Tibial tuberosity, we have to go to the anterior side, back to the anterior side. And we're looking at this little bump right here. So tibial tuberosity. The term shaft is just, again, the diaphysis, the narrow, slender shaft portion. And on the shaft, right where it makes this little point, and unfortunately, that's just not clear on this photograph here. But if you just rub right across your shin, right across your crus, and you can feel that point of bone, that is the anterior crest, or also known as anterior margin. Those are both acceptable terms. And then we've already pointed out medial. Malleolus is the extreme inferior end. So now a closer look, tibial tuberosity. And we got the two condyles. Closer look at that intercondylar eminence here that's raised up between the two condyles. And so now we're moving on to the foot. And the entire foot from heel to toe will all be articulated together, just like you see on this image. So we'll begin with the tarsal bones. Right here at the area of the ankle, there are 7 tarsal bones. And starting with the most superior one, keep in mind we're looking down onto this foot. So this first one here, the most superior, is the talus. The one that makes our heel, the very posterior portion, is calcaneus. Going back to the talus and then moving forward anteriorly, the next bone is navicular. And now these next 3, they all have the same name, cuneiform, and we just have to describe their placement. So from the medial side, and you could reference, of course, the big toe, the hallux. This is the medial side, hence the name. The first bone, medial cuneiform. The next one over, lateral to that, is intermediate, the center of the 3. And then the third one makes sense. Further lateral is the lateral cuneiform. And then the 7th tarsal bone here, known as cuboid. So those different tarsals there. Now the next 5 bones here, collectively metatarsals, but we now have to apply the numbering system, the Roman numerals. And now it's numbered. Number 1 is medial, and then number 5 is lateral. And we just have to fill it in between. So the name of this bone right here is metatarsal, and then Roman numeral 1. And the next one, metatarsal 2, metatarsal 3, metatarsal 4, written like so, IV, and then metatarsal 5. So the Roman numeral, so proper way for the numbering system. And then going on to the phalanges. So similar to the naming of the fingers, your hallux only has 2 bones, so there's just a proximal and a distal. And the remaining digits, numbers 2, 3, 4, and 5, well, there is a proximal, middle, and a distal. So putting that together, if we wanted to name this specific bone here, this would be called proximal phalanx. And it's number 1. Or here, this is distal phalanx 1. And so on. So here for number 3, we would have proximal phalanx 3, middle phalanx 3, distal phalanx 3. And that takes us through the feet. The final page of the lab covers select ligaments, you notice here, starting with the pectoral girdle and then moving on down to the ankle. And we'll just go down the list. And we have our images here of models and charts. And we went ahead and labeled these, but we'll still discuss them. So here we are seeing a model of the pectoral girdle, we see the clavicle, the scapula, the humerus, the area of the shoulder joint. And we can see the labeling. So between the area of the acromion of the scapula and the clavicle, connecting those two areas together, acromioclavicular ligament. We're seeing the curve here of the coracoid process. And it's these two branches together, the two branches of the coracoclavicular ligament. And we see here, once again, coracoid process to the acromion. And that's where we see coracoacromial ligament. So for the most part, just named for the different bone structures they connect. Next section now is the pelvic girdle, and we're using the poster here. And the first one labeled dorsal sacroiliac ligament, so we have to go to the dorsal side. But again, between the sacrum and the ilium of the coxal bone, there's the dorsal sacroiliac ligament. And then we can go back to the opposite side to see the ventral sacroiliac ligament. Sacrotuberous ligament, we're looking from the sacrum, and it's spanning down to the ischial tuberosity. It is a more posterior position, so let's go ahead and turn around to see that better. The sacrotuberous ligament, sacrum to the ischial tuberosity. And there's a sacrospinous ligament connected there to the spine of the ischium. So that's sacrospinous ligament. And we could go back to the anterior side to see that sacrospinous ligament. And the final one, inguinal ligament, right here at the area of the groin, the inguine region. And we can see that span across here for that inguinal ligament. So now moving over to the hip joint, we're going to switch over to this model. And to begin with the iliofemoral ligament, meaning from the ilium to the femur. And there are these two branches together making the iliofemoral ligament. We can see from the area of the pubis to the femur, there's that pubofemoral ligament. And a more lateral view. So again, we can see the two branches that form the iliofemoral ligament structure, the two sections. A better view, I would say, here from the pubis going towards the femur, the pubofemoral ligament. And now we need a posterior view of the model. And here's where we can see a good view from the ischium to the femur, that ischiofemoral ligament. And still, we can see one segment of the iliofemoral ligament, the vertical portion. We have a knee joint model. And the first one, the anterior cruciate ligament, is deeper inside the center of the joint. So what we'll do is we'll take this model, we'll fold down this patellar ligament, and we'll bend the knee slightly. That gives us this view. So we really bend the knee here. So you can see that really small ligament right there is the anterior cruciate ligament. And for reference, here's that patellar ligament pulled and reflected out of the way. Spin it around to the posterior side, and that's where we're able to see the posterior cruciate ligament. The collateral ligaments are on the extreme sides. They can be called tibial collateral ligament, or also known as medial collateral ligament. The tibia bones on the medial side. And then opposite of that, connected to the fibula bone, there is the lateral collateral ligament. We are viewing the posterior side right now. So let's spin it around. Here we are at the anterior side with the knee bent. So again, the tibia is medial. We have the medial collateral ligament, and opposite of that, lateral collateral ligament. And that puts us back here at the first view. So a fibular collateral ligament and a tibial collateral ligament. The meniscus are now these pads of cartilage inside of the joint cavity. And just remember the fibula is lateral. So that will make this the area of the lateral meniscus versus the medial meniscus. And now here we see in the center, this is the area of the patellar ligament. And the bone of the patella, you can see the shape of that bone internally. That's the location of the patella bone. And it develops, you notice, inside of that ligament and tendon structure up here. So then lastly, we have the ankle joint. So we're seeing here, the area of the ankle, the heel. And again, naming for the parts, for the most part, what it connects to. So there's a calcaneal fibular ligament, and we can see the heel, the calcaneus, the fibula. And so we see this ligament right under here, that location of the calcaneal fibular ligament. From the anterior side, from the talus to the fibula, hence the name, anterior talofibular ligament. And now we're viewing, you notice, the lateral side of the foot on this image. We're getting a lateral view. For reference, here's the medial hallux. So now we'll turn it around to a medial view. And we're just looking for this section right in here. And it's all these multiple sections together. Roughly a triangular shape. Hence the name a deltoid ligament.